Hi, I'm Lee McGuire, and I'm here at Advanced Surgical Arts speaking with Dr. Dewey Lee. And today we're talking about how to properly wash your hands and care for yourself through this time of the COVID-19 virus. I don't think anyone's ever told me. Could you share a little bit about that with me since we're in this season of COVID-19?
Frankly, I think it's something that we do all the time without really understanding how to do it really properly. And obviously I'm a physician, but I didn't really learn how to do it properly until I was actually in medical school going through different clinical rotations. That's what they actually taught you. And then being a surgeon, there's a whole protocol of how to wash hands properly. And there are different aspects of hand washing that I kind of want to talk about. So when people watching this can have an idea how to actually protect themselves and their families and their loved ones by making sure that their hands are really clean, okay? So there are different aspects to hand washing, not just washing with water and soap, but actually thinking about different parts of the hands. We never really talk about this because we got our hands, we grab things, we touch things, and we do all the stuff we do with our hands, but there are different parts of the hands that actually come into contact more with different places.
And I think we touch our eyes and our noses and mouths more than we realize.
Of course. I mean, I know I do that.
Yes,
and
me too.
I never really realized until recently when talk about, everybody's talking about, okay, to minimize infection, don't touch your face, and my hands automatically go to the different parts because
I immediately want to touch my face as soon as someone says that. I want to touch
exactly. That's a natural.
At least
reaction.
they'll be clean if you show me how to do that.
Natural. I mean, it takes time for bacteria or virus to actually penetrate the skin to get inside. So you have some time, after you contact, to get rid of that.
The bacteria can penetrate the skin. It
Yes.
doesn't just go through the nose and the eyes and the mouth.
Yeah, and actually, obviously, can carry it into the mucous membrane. So that's why you want to avoid eyes and the nose and touching your mouth.
That's interesting.
There's a much thinner, tissue that you can actually go through. So you can leave something long enough, you can do that. But the whole process really is to look out for, the four basic aspects: top palms, backs of the hands, and the nails, and the cuticles. Those are the main areas, and of course the space between the cross.
You forget
fingers.
that. That's easy to
everybody
forget.
Forgets, but how to wash that?
Right.
And so there's a lot of areas to go through. So when you actually go through the whole process, the 20-second rule we're talking about actually goes by very fast. So this is a demonstration to tell you how to actually clean the hands properly, and the kind of time that we're talking about in terms of washing for 20 seconds and etc. seems a long time, but actually is fairly short when you actually go through these steps. So the areas I'm going to concentrate on obviously are the hands, the palms, and the fingertips. And what's interesting is the cuticles actually have little spaces underneath, and that can actually be a trap and a source of infection and then dirty things as well that if you come into contact with them. And certainly we all know about nails, and underneath the nails, especially if you have some people who have actually longer nails and whatnot, that little space underneath is very important to clean properly so you don't actually retain anything that's dirty or maybe infectious. First, just wet your hands thoroughly. That will get initially all the dirt off of the hands, and then apply a generous amount of soap. It doesn't really matter what kind of soap you use. Let's just start the whole washing process. So rubbing very, very carefully. The way I rub obviously is all of the entire palm, and I always lace my fingers to make sure all the space between the fingers are completely washed and running back and forth to reach the spaces in between at the base of the fingers as well. And then once that is done, I actually start rubbing all over the backs of the hands as well. And I curve my fingers so the wrinkles on my knuckles get opened up, and so I can approach all of those separately and individually. Make sure the thumbs get attention, because we are usually always washing the fingers. Thumbs get very little attention. So once that is done, and what I do is actually curl my fingers, and I rub my nails on my palm back and forth, and that gets the soap inside under the nails as much as possible. And then I rub my fingers over the cuticles individually as well. So that gets the soap inside the cuticles and the edge between the skin and the nail with some pressure. You want some pressure because you want to have the soap and the fluid go actually into that space. And when you actually go through this and do that thoroughly, 20 seconds go by in a flash, washing, and then basically go through the entire process and thoroughly rinse off. All the soap, and then dry thoroughly using a paper towel or whatever you may have at home. That is a very thorough process of cleaning your hands, and I think something that really should be done on a fairly routine basis for everybody that's concerned about infection and limiting the kind of infection that we may have.
All right, thank you, Dr. Lee, so much for sharing this with us. I know I've learned so much on how to properly wash my hands. I hope you have too. Until next time, thank you so much for joining us. I'm Lee McGuire.